Patient, Mr. Curtis.
Thank you, Madam Chair. And Ranking Member Guthrie, not only for this hearing and for hearing my bill today, but for putting these hearings together in a tough environment with COVID, with votes, and all of our other responsibilities. And so thank you for your patience, which we don't always recognize. The Helping Enable Access to Life-Saving Services Act, or the HILS Act, is my bill, and I'm very proud of it. It reauthorizes the grant program established by the 21st Century Cures Act, something that happened before I came here to Congress. Funding within the grant would be used to help eligible groups to recruit, educate, and provide learning opportunities for behavioral health care students, including substance use disorders, specialties, psychiatrists, psychologists, and social workers, just to name a few. The HILS Act is especially important to me because Utah, unfortunately, has seen significant increase in demand for behavioral health care services throughout the COVID-19 pandemic, not unlike our nation. As a matter of fact, the nation has seen an overdose rate increase by 30% year over year. Dr. Keel, I don't have a question for you, perhaps a comment, and to you and some of the other panelists. I've watched over the last few years my son, who's now practicing psychiatry, go through medical school. And you might all enjoy that. I visited him once while he was going through medical school, and he had his water heater turned off. And he was trying to save money to lower his student debt, right, when he came out the other side. And I know firsthand the difficulty and the sacrifices these healthcare workers make. My wife's a physical therapist and does home health care visits. Dr. Wilburn, you're smiling behind the mask, and I've seen the impact on her firsthand as well. So thank you for your testimonies today and for all that you're doing. Mr. Lewine, I'm curious how your doctors have been dealing with the increase in demand for behavioral health care services since the beginning of the pandemic.
Well, it's obviously been a huge concern for us. Right now, we've expanded our employee assistance program. We're leaning into every hospital. We have 21 hospitals. We're leaning in every hospital to make it available. And based on what's been said here, I agree. Convincing people that it's not only necessary to seek help when you have it, it's a sign of strength, not weakness.
Right.
And we're doing a lot of education to try to get our physicians and our frontline caregivers that work with the physicians to take advantage of those opportunities.
If you're familiar with the HILS Act, are you able to comment on how that would help your situation?
I'm not familiar with all of the relevant details of the HILS Act, but I can tell you that we would definitely be among those that would apply for these grants, because we think incrementally can help us link further in with our physicians.
You'll smile when I say that my district is about 80% rural. A lot of you here will understand what that means, although I do like to tease my colleagues here from the East Coast. I think we have different definitions of rural, and we are really rural out in Utah. It won't surprise you that telehealth was really critical before the pandemic and has been even more important during the pandemic. And Dr. Levine, again, as it relates to audio-only telehealth services, can you share how Ballard Health specifically has been dealing with that in context to behavioral health?
It's been a huge opportunity for us. Right now, we're in about 106 schools throughout our rural region. Many areas are very, very rural. And so we've got several behavioral programs that we deploy that way, and the audio is really important. Obviously, we'd like to have bandwidth to be able to do full video. And frankly, during the pandemic, some of our largest physician practices, our very large cardiology group, were able to keep up with the patients purely because of the telemedicine and because of audio. So I absolutely agree that opportunity is something we would want to continue to expand and take advantage of.
Do you have any suggestions for Congress as we think about the long-term cost benefits of expanding the audio-only telehealth behavioral services with Medicare patients and others that promote this reliable access to quality care?
I think the payment mechanisms that could institutionalize that would be helpful, and making them more permanent and predictable. I think that would help create more investment into the growth of those mechanisms. And certainly I would always advocate for more broadband to help with getting beyond audio.
Yeah, broadband is clearly an issue for rural districts. I've got just a few seconds left. I don't know if anyone else wanted to comment. Yes, Ms. Harrison, in just a few seconds, please.
Thank you. I just want to mention that my brother is a nurse in rural
Utah
Oh,
and works in a school system. So I would just add to the importance of including schools in your bill for mental health, behavioral health services, and telemedicine.
Thank you for that exclamation point on my comments. And Madam Chair, I'm out of time. I yield back to you.